Okay, hey there guys. Today I'm starting a new mini series that's focused more on outpatient settings. I talked a little bit about my speech issues yesterday, and I'm sure you noticed that in some of my videos. And again, it takes me a million tries before I get the right one. So if y'all don't mind being patient with me, these are definitely not like well-made professional videos, but we're talking about real things going on in healthcare. I was a nurse for 20 years and now I'm a patient, and there are things that I'm seeing that I did not see before. So I think my lived experience on both sides of the bedside can be helpful to others, and my goal is that you will feel less alone. Since becoming sick, I've developed these artistic abilities and writing. This is not something I had before, and it wasn't ever really a part of my life. I truly see this as a gift from God. It has given me a way to communicate more clearly and honestly, especially in situations where things are easily misunderstood. A lot of what I say comes out wrong, and people don't always take the time to pause, ask for clarity, ask questions before drawing their own conclusions about what was said or how it was said. So knowing that, please forgive me if any of this comes out wrong and you want to ask a question or you want to tell me about your experience. I would love to hear it. So part one, if you feel like you're not being heard in healthcare, you need to watch this. If you've ever felt like something changed in outpatient care, but you can't quite name what it is, this might explain part of it. I want to start by saying something very clearly. This is not about blaming med techs, nurses, physicians, or medical assistants, or anyone else in the healthcare system. In my experience, most people working in healthcare are doing the absolute best they can inside the system they are given. This is about something else. It's what happens when the structure of care changes, and what patients experience when those changes are invisible on the surface, but very real in practice. Over the last several years, I've noticed a shift in outpatient clinics. In many settings, nurses are no longer consistently embedded in day-to-day patient communication, medication decisions, and triage in the way they once were. Instead, a lot of these responsibilities are distributed into task-based roles, often supported by templates, protocols, and checklists. And I understand why that shift happened. It is often about efficiency, staffing, and cost. But what I've seen both professionally and personally is that something important can get lost in that transition. And not because anyone is doing anything wrong, but because not everything in healthcare is a task. Some parts require interpretation, some require context, and some require clinical judgment in real time. Things like when a medication refill is urgent versus routine. When a patient message needs escalation versus just some reassurance. When symptoms are low risk versus a big red flag. And how documentation reflects what is actually happening with a patient. These are not always simple checkbox decisions. And when those decisions are reduced to templates or workflows alone, something subtle happens. The nuance starts to disappear, and the patient experience becomes more fragmented, sometimes without anyone realizing it in the moment. I want to take time in later videos to break that down more specifically, because this shows up in medication refills, triage decisions, in documentation, and even in how patients are educated about their own care. But for now, I just want to start here. This is not about people, it's about structure. And what gets lost when clinical judgment is no longer consistently present at the point where patients need it most. We need to remember the human in healthcare. This is just a nurse writing from a patient's chair. Thank you, and I'll see you again tomorrow.